Hello and welcome. We are going to be demonstrating nerve conduction studies and electromyography, also called EMG. This is the equipment here. I'm going to be taking you on a little tour of the machine, so to speak, and actually demonstrate some of the tests for you so you have a better understanding of what the procedure is and how to prepare for it. So let's bring you on in. The first part of the test is called nerve conduction studies, or abbreviated NCS. Our nerves use electrical signals to send their impulses. So for this test, yes, we are going to use electrical signals. You're going to feel little electrical stimulations, little pulses along the course of the nerve. Some of the lighter stimulations check the sensory nerves. So for example, the carpal tunnel nerve goes to these three fingers, so you'll feel a little stimulation along this course. Whereas this nerve comes from the ulnar nerve, which is also nicknamed the funny bone nerve. When you bang your elbow and you feel that little sensation go down your hand. For the slightly stronger stimulations, where we apply a little stimulation, you're going to get a little motion in the little muscles, for example, of your hand. So it feels a little funny. Now we're going to demonstrate this right now, and yes, I am going to be demonstrating it on myself, so I know exactly what it feels like. I know what you're going through. So here is our setup. We have a recording electrode, a reference electrode, and a ground electrode. We take measurements along certain pathways along the nerve. We have the stimulator probe right here, and on screen you're going to observe the response. So here we go. We turn up the stimulation to a reasonable level, and then we apply a little electrical stimulation. We can turn it up to see if we get an improved response, and as we go up and up, we get a higher and higher response until we reach about a steady state. Next, we can record at a site distal, in this example, across the carpal tunnel here, and then we get another response there, and we can measure conduction velocity across the carpal tunnel. Okay, here we go again. We now have a motor set up. So this is again checking the carpal tunnel nerve, going to this muscle in the thumb, recording electrode, reference electrode, ground electrode. We have our stimulator here, and when we turn up the stimulation here and start to apply a signal, we don't get much of a response on the screen yet, because it's not enough to get a motor response. So we have to turn it up a little more. So yeah, you are going to feel this a little more, and you can see that my thumb is moving, and as we kind of turn it up, we get a stronger and stronger response. Now, yes, this does feel a little odd at first, but you do get used to it, and then you can get a nice motor response on screen and measure it for speed and conduction velocity and amplitude. And for the next part of the test, called EMG, we record the natural electrical signal going on in your muscles. Now, the only way to check the signal going on in your muscle is to use, yes, a little acupuncture-like electrode, very similar to an acupuncture needle, if any of you have had acupuncture before. Now, some people dislike acupuncture. Some people love acupuncture. So for those of you that are not a fan of acupuncture, yes, there might be some brief episodes of mild discomfort, but it is much smaller compared to a needle that you get when you get your blood drawn, or if you get an injection. It is very similar to an acupuncture needle. And yes, we are going to be demonstrating it right now on yours truly, and we did the arm before, so this time we are going to use the front of my leg. So I'm going to put my foot right on the machine for ease, and you're going to check out what's going on. And lastly, we sometimes employ ultrasound. Commonly, for example, across the carpal tunnel. We can scan the carpal tunnel and locate the median nerve and check to see if it is enlarged or inflamed or entrapped. It's the dark circular structure in the middle of the screen. I can zoom in for you, and we can take a little bit of a closer look and measure the cross-sectional area. If I freeze and bring that back for you to get a little example here, it's that black circular structure right here. So there you have it, a quick demonstration of EMG, so you can better appreciate the test and have a good understanding of what goes on when you have this procedure. Hope you enjoyed the video.